And here's the thing. Should we go for a 2-week lockdown and just see what happens? I think most of us probably know the answer. Would you favour a 2-week, like a mini lockdown, if you like? 2 weeks, no more. Full lockdown, 2 weeks. And just see what happens. This is the news that we heard earlier, that Professor Chris Whitty is pushing for a new 2-week national lockdown amid concerns the true number of coronavirus cases is far higher than being reported. This is according to a former World Health Organization expert, Anthony Costello. Now, he, of course, sits on the independent SAGE panel. He made the statement on Twitter on Wednesday, adding that the daily infections could be as high as 38,000. Mr. Costello has now mysteriously removed the tweet, saying he was mistaken. So initially he said, and I looked this up, in fact I'm not sure he has removed it, might still be there. Initially he said, look, I've got word from the inside, and you might think this is a fella that's got contacts in high places, saying that Professor Whitty is pro a 2-week lockdown. And then about 12 hours later, another tweet saying, I'm mistaken. Apparently that isn't the case. Now, having over many years seen the pattern of people make announcements and then withdraw them, my money, and I hope with a reasonable amount of qualification, says that he removed it because it was probably politically savvy to remove it. It comes, of course, after Boris Johnson insisted he was doing everything in his power to avoid plunging the country back into blanket restrictions, voicing fears that we could not afford it even if we wanted to do it. 0344 499 1000. So we know that large parts of the northeast are going into a kind of version of a lockdown. Curfews at 10 o'clock. Now, let's just start on that point. If you were ever pondering the futility of this, and I've been, I think, rather generous to the government over the last few weeks because I'm aware it's a changing story. I'm aware that new facts emerge all the time. I'm aware that what looks like sound advice one day could turn out to be completely futile advice the next. That could be based on new information. It could be based on new cases. There's a whole number of things. So if you look around the country, if you were trying to write a coherent 500 words on lockdowns, restrictions and testing across the UK, you would find yourself in this labyrinthine world of nonsense where you just simply couldn't quite work out what was going on because it differs. Now, I get the whack-a-mole strategy that they were saying. It might be that some areas there's a spike, so we have to have a bit of a lockdown there. That doesn't mean to say we do it everywhere. So in principle, I understand that. But can somebody just, to coin that rather annoying phrase, riddle me this? Let's just take the pub curfew. Pubs close at 10 o'clock. Okay, on that basis. Now, what is more relevant to the potential spread of coronavirus? The time the pub closes or the amount of people sitting in the pub? The time the pub closes or the amount of people sitting in the pub? So you could have 100 people sitting in the pub, but 100 people. But at 10 o'clock, they've all got to go because of the witching hour of 10. It's the COVID hour. Is that when it all happens? Is that when the infections take place? Is that when people start going all manky and irresponsible at 10 o'clock, suddenly kissing and touching and hugging? Well, it might be. What if there's only 2 people sitting in that pub? 2 people. So 2 people till 11 o'clock. Fine. 100 people till 10 o'clock. It can't surely be both. Now that science, I would have thought, and I stand to be corrected here, would have to be based on numbers of people. Isn't the whole infection issue based on numbers of people? I heard one prominent clinician endorsing this, saying it's absolutely right. It's an hour less. All the hours matter. If you close a pub at 10 instead of 11, that's an hour less of people potentially infecting each other. I mean, if that really is your concern, you wouldn't open the pub at all, would you? But where does that leave the amount of people in a pub? And this is the nonsense of the situation. And then if you thought that was illogical stuff, then have a listen to this. So the London Evening Standard, the local rag down there in the capital, printed their pointers and factors surrounding the potential of a curfew. So they're talking about 500,000 students coming to London from around the country and around the world for the start of the new term. This could increase infections. Okay, I've got that. Demand for testing is outstripping capacity. That could increase infections. About 10 London boroughs have coronavirus rates of some 30 cases per 100,000 population over a 7-day rolling average. Young people in the capital are fueling the rise. There's also other factors. They're doing this in a bullet point style. These are the warnings. It was not clear where people caught the virus when asked about clusters of cases. The next sinister bullet point: schools are now understanding their role much more effectively in dealing with suspected cases. Next point: the tube is safe. Get out of here. The what? The tube? The tube? What? The thing that goes underground with the kind of enclosed tin machine that sits in cramped conditions underground is safe. So I'm being told here that one of the problems that might lead to a curfew, or certainly something that looks like a bit more of a lockdown, is the fact that 500,000 students are coming from all over the show. They're mixing. I'm also being told here that we've got 30 cases per 100,000 in 10 London, but 33.0, by the way. These are all markers of why London needs to be super vigilant, and things could get a whole lot worse. And on it goes. London, about 150. Demand for testing is outstripping capacity, with the numbers of tests in London about 150,000 a week, as they are focused hotspots in the North and the Midlands. The number of positive tests announced for the city yesterday was 278, though this may be an underestimate given the shortages. All sinister stuff. And then at the very end of this, they say the tube is safe. If you ever wanted to lose faith, you can't have it both ways. If I'm going to listen to the expert, I don't know whether this is the barking mad mayor of London or whether it's some other clinical base that has put this together. These are all the reasons why there might be something that looks like not a full-on lockdown, but curfews, that kind of stuff. And then they write the tube is safe. The one area where you absolutely know you're going to have thousands of people like sardines crammed into a tin can underground, potentially for an hour, is the tube. The one area where you wouldn't need a clinical degree. You wouldn't have to be an epidemiologist or a virologist or anything to know that this is clearly an area that would be, in terms of following the advice that lots of people in a crowded place is the problem, then surely numero uno on your list of consistency would be the tube, right? Anyone could, I'm pretty sure, without much knowledge of how a virus works, would say, well, I'd go number one on the list. They've written here the tube is safe. Now, I happen to believe that all of these areas, if you play by the rule book, can be safe. As safe as you can get it. As safe as it can be when you're trying to challenge a virus that is, you could never fully eradicate like that. Unless there's going to be some magical vaccine that just pitches up tomorrow and we all get it, then you've got to run with it and deal with it. You can't be saying the tube is safe if you're saying all of these other areas are big problems. You cannot be saying that closing pubs at 10 o'clock is a very sensible thing to do when there could be 300 people sat in that pub. This is all a nonsense. So what I would say is let's try the 2-week lockdown. And let's say we're all the lockdown fanatics, and there are people calling for this. They're usually people who don't have a problem working from home, or people who've got enough disposable income to not work at all. But then you have to be a bit more of a realist about the whole picture here, surely. And the whole picture is that we still have very low cases. They might be increasing. There's more testing. And, of course, until we see a rapid rise in people dying of this or plugged into ventilators, then right now we are not seeing a huge spike in lethal coronavirus problems. 0344 499 1000. I would say to all of the people that are advancing some of these partly terrifying, some might even say scaremongering views and lines on all of this, and all of the people that are very much behind curfews and second lockdowns. I just say to those people, okay, let's have 2 weeks. Let's do a lockdown for 2 weeks. Because I promise you, when you come back after 2 weeks, we're going to be in exactly the same position as we currently are. As sure as night follows day. We'll be back there. We'll have 2 weeks of going, oh, look, the figures have gone right down. Right down. Fantastic, isn't it? Yeah, okay. What about the week after that? Well, they're going up a little bit. Yeah, that's because it's a virus, and that's what it does. A 2-week lockdown, a 10-week lockdown, a 1-year lockdown, this is nonsensical. So to the witties of this world, and all of those that are endorsing and preening their whiskers at how sensible they are, you've got to be very careful about this. Pubs close at 10 o'clock. If you were that serious, you would be closing pubs. You wouldn't put this miraculous 10 p.m. deadline on it. Nonsensical. Doesn't make any sense. So let's give it a go. Would you support that? A 2-week lockdown. It will do one of two things. It will flush it out for good. And people like me will come back to the radio and go, it worked. Whitty was correct, even though he's denying he ever said this. Whitty was correct, and the like. It worked. A 2-week lockdown, fantastic. The virus is gone. We can all go home now, get back to normal. Or, and this is where my money is, we'll be back in the same position as we currently are. And that's the position of somehow, through thick and thin, we've got to see this thing through. You can't close an entire country. You can't start meddling with confidence. You can't start telling people that, well, yeah, you can open a pub, but you've got to go home at 10. Right, okay. 5 past bad, 5-2, 5. Yeah, all of this kind of mumbo jumbo. Well, let's speak to Professor Hugh Pennington, Emeritus Microbiologist at University of Aberdeen. Afternoon to you, Hugh. Always good to have you on. So, I mean, let's just look at what's happening at the moment. Talks of curfews, different alterations to rules in the northeast are announced in the last hour or so. Are we heading for another lockdown, do you think?
I hope not, because the virus is busy in some parts of the country, but in other parts of the country, it's not busy at all. And a national lockdown, it would be very unfair to say to Devon and Cornwall, which always have had relatively low rates of infection, no big problems there. But northeast and northwest of England, yes, problems, and Glasgow problems. But where I'm from, Aberdeen, we sorted out we had a big outbreak to do with pubs. Well, we shut them for a while. The outbreak is gone. We've got a very small number of new cases, and the pubs are back in business with the social distancing, all that kind of stuff. So local action is what's needed to really hit the virus hard where it's busy. But other parts of the country, I think we keep up with the social distancing, the 1 meter, 2 meter, behaving sensibly in pubs and restaurants. And I'm afraid that gyms might be having a hard time, and perhaps, we don't want to have very big occasions where everybody gets together to have a sing, because we know that's a very good place for the virus to get about for the time being, until we get the virus down to the levels that it is, for example, in New Zealand, where they've got no new cases today, no new cases yesterday. They've had an importation of virus, which they've coped with extremely well. Okay, it's had a very hard effect on their economy, but on the other hand, they're going to have a much easier time in the future because they've got a grip on the virus.
But I mean, as you know better than me, Hugh, we can't always compare like for like, but just taking that as an example, of course, I mean, you said it there, huge damage to their economy. And of course, the problem with lockdowns is that things do go away for a while. One of our contributors mentioned Melbourne in Australia, one of the strictest lockdowns on the planet. But of course, as they begin to ease those lockdowns, cases begin to rise again, almost as sure as night follows day.
Well, I'm not so sure about that. I think, yeah, we've come out of our lockdown. The virus has got busy again because it never went away in the first place. And in some parts of the country, people have behaved, well, I would say, irresponsibly. I mean, that was the sort of problem in Aberdeen, where people were obviously seen to be doing things in pubs which helped the virus to spread. We put a stop to that.
They only put a stop to it by closing the pubs, right?
But for a while,
Yeah.
not permanently or anything like
No,
that.
indeed. But as they
And
open up, there's going to be more cases, surely.
there will be more cases, but this virus is not like flu. I don't think it's going to hang around forever like flu does. And well, flu doesn't hang around forever. It comes and it goes. And one flu virus is replaced with another.
Yeah.
This is a simple virus. We can really get to grips with it like they have in the one country nobody wants to talk about these days is China, where they had only a handful of new cases yesterday, all imported, because they've managed by having a pretty drastic lockdown, doing things we couldn't do about transport blocks and all that kind of stuff. Although we had that in Aberdeen, we weren't allowed to go more than 5 miles out of the town, and incomers couldn't come in either. But nevertheless, I think if we get these things in a right balance, I think we can see the virus off, and we can see the virus off in such a way that it will go away and it won't come back, just like SARS did. A very close relative of the virus, SARS is gone, it's eradicated, and my hope is that we can do that with this virus. A vaccine may help, but it's not going to be essential.
But we're at the moment we're seeing these kind of localized lockdowns, Hugh. We are seeing more cases, not a huge increase in hospitalizations and deaths, but the direction of travel is that that's kind of where it's headed. So based on the government's own advice, there's going to be more lockdowns.
I'm afraid there will be, because the virus hasn't gone away, and in some parts of the country it's doing reasonably well. It's not doing the sort of very unpleasant things that it was doing way back in March and April, and we didn't really pay enough attention to stopping the virus getting into care homes, for example, which is one of the major tragedies. That half the deaths that we've had have been in care homes because the virus got in there. It got in quietly. Many of the people who took it in didn't know they had the virus, and quite a few of the residents got infected without knowing they had it either. But unfortunately, some of them had a very hard time and died. And so we can control that much better than we could in the past, because we know how to do that by testing. The key to getting the grip on this virus is having a very good testing regime, and that means testing whenever somebody thinks they need a test, they should be able to get it. And whenever somebody thinks they need a test, they should get the results preferably within 24 hours and certainly within 48, so something can be done about it. And unfortunately, that's the weakest part of the government's plan at the moment, is that they haven't ramped up testing enough so that we can offer that, as the Prime Minister would like to do, and we can offer that on a grand scale. And I'm not sure why not.
But why are you confident, Hugh Pennington, that we would see this thing go away? I mean, that we did have the big lockdown, then we eased the lockdown and the cases are coming back. What would be different if we had another lockdown? Why would the cases not return as normal? Do we just keep doing that forever? That would be insane, surely.
Well, we have local lockdowns because the virus is not behaving in the same way in different parts of the country. And to do a national lockdown which would affect Cornwall to the same degree as say Newcastle would be quite wrong, because the problems there are quite different. The amount of virus is quite different. And so we have to be more measured in our approach. Okay, there will be economic damage in areas where the virus is busier, but there won't be the same economic damage in other areas. If we don't have a national lockdown, other parts of the country will recover much more quickly. So long as we have testing to make sure that the virus isn't being surreptitiously introduced in places like Cornwall, for example. We know in Scotland, for example, the Northern Isles and the Western Isles have hardly had any cases at all. And the virus is under control in those parts of the country, like it is in the Isle of Man, for example. But now, they're easy because they're islands, and they can stop people coming in, and they can test people. So if somebody does bring it in, like has happened in New Zealand and in Australia, we can do something about it and stop the virus taking off again. So I'm moderately optimistic as long as we get the testing regime sorted out. That's the key to success.
So not a 2-week lockdown, a quick, hard, fast 2 weeks, everything closes, let's see what happens.
No, I don't think so, because that will create enormous damage. What about schools, for example?
Sure.
Would they be brought into that? Well, schools are not particularly good places for the virus to act as a sort of incubator of the virus. Unlike flu, this virus is not flu. It's very different. With flu, schools are incubators of the virus. The kids take the virus home, infect their grandparents with catastrophic consequences quite often. this virus is not behaving like that. That's not to say there aren't outbreaks in schools and we have to attend to them. But most of the cases are probably going to be in the teachers rather than the pupils.
Sure. On that point, Hugh, thank you. Professor Hugh Pennington, Emeritus Microbiologist at University of Aberdeen, with us on the programme. I'm going to throw this over to you. We've got a lot of calls racked up already on this. 0344 499 1000. When we hear rumours that Chris Whitty, denied by the way, but rumours that Chris Whitty, Chief Medical Officer, endorses the idea of a 2-week lockdown. Clearly that thinking came from somewhere. Do we, in order just to prove the nonsense, the contradictory messages, the confused lines that are coming out of various parts of the country, the absolute out-and-out duplicity. Let's blame a load of students, but not the tube. Let's close pubs at 10, but not half 10 or 11. I mean, this is the kind of nonsense that begins to play with your head to the point you say, well, let's have the lockdown. Let's do it. Let's go with a 2-week lockdown. I promise you, we'll be back here quicker than you could say virus. And believe me, everybody knows listening to this that there are still going to be people who contract it, and nobody is suggesting otherwise. Of course, it's the management of it that is crucial to it. Is it a lockdown?